Sir, good afternoon.
Good afternoon, ma'am.
Where did you travel from to India?
Yes, I traveled to India for a purpose.
Okay.
My purpose of traveling to India is to solve or resolve the lingering problem that had been disturbing me for some years.
Can you describe your problem for which you came to India?
Yes, of course, I can describe my problems. My problems started about 13 years ago.
Okay.
Started with the spinal to the extent, if the problem started, I can't move.
Okay.
I remain in one place for some days.
Right.
Maybe taking pain relief.
Okay.
How do I resolve this problem? It has been lingering.
Right.
And I have nothing to do. I keep on asking questions. Where I can travel to that this problem can be resolved.
Correct.
Luckily enough for me, my elder brother was once here, Musa Dangana.
Yes. I operated him, right? Yeah.
That is what he told me.
Right.
And he said he's going to link up me with Amir Kumar.
Yes.
That's associate somebody in with Fortis Hospital
Yes.
in 𝗙𝐷𝐵𝐵.
Yeah.
And I said, okay, call Amit, gave Amit my number, and Amit called me. We started interacting with Amit,
Right.
and Amit told me that my problem is going to be resolved, but I should send a copy of the MRI
Yes.
to him,
Yeah.
of which I did.
Yeah.
When I sent this copy to him, I don't know then, but later he called me and said my problem can be resolved here in India.
Wow.
with Dr. Sonal Gupta.
Yeah.
I said, oh, sure. He said, yes. That's very good. What do I do? How do I start coming to India? Amit assisted in facilitating my movement from Nigeria to
Yeah.
India.
Yeah.
Amit have done very well in how to get the visa from Indian embassy in Nigeria.
Correct.
All are Amit's efforts.
Great.
When we started proceeding, the procedure of the visa, at the end of the day, I was issued a visa
Great. Great.
from the Indian embassy in Nigeria. And I told Amit that yes, a visa has been issued to me.
And you came here.
Amit said, that's right. He's happy about it.
Yeah. What was your excruciating complaint, the maximum complaint that you had when you came to me?
The complaint was from my spinal.
Yeah, but what was bothering you? If I correctly remember, your right hand shooting pain, right?
Yes. The major thing then was the right hand
Yeah.
being shocking.
Yeah.
Shocking as if it was an electric shock.
Yeah, you told me that. Then we repeated your MRI here,
Yeah.
right? And we found out that you had 2-level discs that were pressing onto your nerves.
That is what you told me.
Yes, and on examination, in fact, you remember you couldn't straighten your elbow with as much power as in your left
Of
arm.
course,
Am I
of
right?
course.
Yeah. and then we did your surgery. And how were you after surgery? On the very next day, I want to hear.
It's something I would laugh, because when you saw something, you believe it.
Yeah.
I've seen it myself and I believe what happened. The next day when I wake up in the morning,
Yeah.
the experience I've been experienced in my hand,
Yeah.
the shocking,
Yeah.
wasn't there.
Wow.
I said, wow, what is happening? I said, no, call my wife for me.
Yeah.
Right away she called my wife. And I told her that I have not been hearing the shocking again. The shocking is no more there. And the pain from the head one-sided is no more there.
Your wife would have been excited to hear
The only
that.
pain I am feeling now is right from my back.
Yeah.
That day I was so excited.
And as I examined you on the very next day, your power in your right hand also has started improving already. Am I right?
Yes.
Yeah.
Started improving. Even stronger now
Stronger now.
than before.
How did you find our hospital and the entire team? We want to hear.
Well, Fortis Hospital in Shalgawa is a very fantastic and wonderful hospital. It is going to be a hospital I will never forget in my life.
Thank you so much.
And the doctor herself, that is Dr. Sunal Gupta, a doctor I will never forget in my life.
Thank you. Thank you so much.
Doctor have done a lot for my system. My people at home,
Yeah.
if I get back early,
Yeah.
they will never forget you,
Yeah.
because you have bring back their leader
Yeah.
to the system, whereby you have the ability to serve them.
Yeah. True. Indirectly through you. Am I right?
Yes.
Yeah. Great.
Yes. So Nabgupta, I think I don't know what to tell you. I can only say it is only God that will protect you.
Thank you so much.
It's only God that will give you more strength.
Yes. Very true.
So that you can save more lives.
Yes.
The way you saved my own today.
Thank you so much.
Thank you very much.
I am Dr. Sonal Gupta. I am Director Neurosurgery at Fortis Hospital, Shalimar Bagh. I have a keen interest in operating on spine. I do lots of domestic Indian patients, but I had an opportunity this time to operate on an international patient traveling all the way from Nigeria for his persistent cervical spine complaints, which he has been suffering for more than 30 years. I was fortunate to operate on his elder brother, who recovered very well and went back to his country, and he was the one who recommended my name to him, and he came here with complaints. He used to get excruciating electric shock like pain in his right hand, and he is a political leader there with lots of responsibilities on his head, which obviously he couldn't perform very well because of the ailment that he was suffering. He wanted a permanent solution to his complaints of spine and electric shock like pain traveling down to his right hand. He had shared his reports through Mr. Amit, and on reviewing the MRI images, I had a tentative plan on operating on his cervical spine, in which 2-level discs were compressing the nerves and which were responsible for his complaints. But in spine cases, a neurosurgeon cannot be really very sure without reviewing the clinical details of the patient. So when patient arrived to me in the OPD, I examined him and had listened to his complaints, and I found that he also had a right elbow weakness because of the compression on the nerve. Since his MRI was an old MRI, I repeated a fresh MRI at our organization, and we found that he had significant disc at 2 levels compressing the nerves. So I explained him the plan of operating on his cervical spine. There is a small incision of about 2 inches on the anterior part of the neck through which you go in With a microscope, you remove 2-level disc and you put an artificial titanium implant there so that the spine doesn't become unstable. One day for observation and better care, patient is shifted to a high dependency unit. He was fully conscious, moving all 4 limbs, and soon after surgery itself, he felt that he didn't have a pain, but he was still under effect of anesthesia. So I wanted to wait for his honest opinion on complaints on the very next day. As you heard from the patient, that patient's symptoms had completely disappeared the next day and he was very excited about it. On 3rd day, he was discharged from the hospital and has been a week now, and he is ready to fly back to his country. His wound has completely healed. He'll be wearing the collar for next 1.5 months, and he is fit to serve his people in his country as a great political leader, and I wish him all the good luck in future. And that is all about spine surgery. People in the society are actually scared of spine surgery, but this is how safe it is.
Thank you very much. We appreciate it.
Thank you.
God bless.
Thank you.